Medical malpractice claims may be asserted against any healthcare practitioner, including nurse practitioners. While there may have been errors on the part of other providers, this case study focuses on the actions of a nurse practitioner, our insured, working in a medical office setting. The patient was a 49-year-old male that was experiencing bleeding during bowel movements. His wife was an established patient of our insured and made an appointment for her husband due to his rectal pain and bleeding. The patient has a family history positive for colon cancer and cardiac disease. The patient complained of bright red rectal bleeding on and off for 2 months. Additionally, on several occasions, he noticed that the toilet was full of blood. He denied complaints of weight loss, abdominal pain, fevers, or chills. A review of the case study so far reveals the following. The patient described in this case study is a 47-year-old male with a chief complaint of intermittent rectal bleeding for the last 2 months. His past medical history is significant for heavy alcohol use, hypertension, depression, anxiety, and a family history that is notable for colon cancer and cardiac disease. The nurse practitioner performed a detailed physical assessment on the patient along with a digital rectal examination. The digital exam was negative for any tumors or tears, and she diagnosed the patient with bleeding due to internal hemorrhoids. The nurse practitioner advised the patient to have a colonoscopy to rule out other disease. The patient adamantly refused any referral for this procedure. He was given prescriptions for suppositories and a hemorrhoid cream and a revisit in 3 weeks. A summary of actions taken thus far in the case study reveals the following. A physical exam was completed by the nurse practitioner, which included a digital rectal exam with a negative result for tears or tumors. The nurse practitioner's clinical decision regarding the patient's condition was a diagnosis of rectal bleeding due to internal hemorrhoids. The patient was advised to undergo a colonoscopy to rule out additional diseases, but he refused the nurse practitioner's recommendation. Prescriptions were written for the patient by the nurse practitioner to treat the internal hemorrhoids, and a revisit was scheduled for 3 weeks later. Things to consider and appropriate actions following refusal of a colonoscopy. Why did this patient refuse the colonoscopy? With his history of anxiety, this refusal should have been explored further. Could it be fear of the procedure? Anxiety about the prep prior to the procedure? Concerns about anesthesia? Next, does the patient understand the risks? His risk factors include age, race, family history, alcohol use. Additionally, what are the guidelines? Colorectal cancer screening recommendations from the U.S. Multi-Society Task Force on Colorectal Cancer include a first colonoscopy at age 50, with limited evidence to support age 45 for African Americans. For those refusing colonoscopy, an annual fecal immunochemical test is recommended. Personalizing the discussion can often ease a patient's fears. Written instructions should augment and not replace any discussions with the patient. A firm understanding of all current cancer screening guidelines and/or recommendations can also contribute to patient success and outcomes. During the 3-week follow-up appointment, the patient reported that the rectal pain and bleeding had stopped and he had not noticed any blood in his stools or bleeding. Over the next 18 months, the patient was seen 11 times by both the defendant nurse practitioner and another physician working in the practice for various other complaints, but never relayed any concerns about continued rectal pain or bleeding to the insured. The nurse practitioner never had any further follow-up discussions with the patient about a colonoscopy. Approximately 20 months after the patient's initial office visit for rectal pain and bleeding, his wife made him an appointment to have a colonoscopy due to the patient's continued rectal pain and bleeding. During the procedure, the gastroenterologist found a 4-centimeter tumor in his rectum, and the patient was diagnosed with differentiated metastatic colon adenocarcinoma. The patient died 1 year after his cancer diagnosis. A review of the events that followed the initial visit reveals the following. At the 3-week follow-up visit after the initial visit, the patient did not report any further episodes of rectal bleeding. The patient was seen 11 times over the next 18 months by the nurse practitioner and a physician for various complaints, but never relayed any concerns or episodes of continued rectal pain or bleeding to the insured nurse practitioner. The nurse practitioner had no further follow-up discussions with the patient about a colonoscopy, and there was no documentation regarding conversations about the initial colonoscopy recommendation and the patient's refusal. The patient's rectal bleeding returned at approximately 20 months after the initial visit with the nurse practitioner. A colonoscopy was performed on the patient, and the procedure identified a rectal tumor. The final diagnosis was differentiated metastatic colon adenocarcinoma, which led to the patient's death 1 year later. The nurse practitioner could not fully explain why she failed to document her conversation with the patient about having a colonoscopy and his subsequent refusal. She stated that her medical office utilizes an electronic medical record and she relies on the system's drop boxes to assist her in her documentation. The discussion about the referral for a colonoscopy would have had to be manually entered into the medical record, and she may not have had the time between patients to document that conversation. The nurse practitioner stated that she did not have time to, quote, manually enter into the medical record, close quote. To cope with the lack of time, make sure that all major points are listed in the chart before moving on. The details can be filled in later. Problems, questions, or concerns with system technology for reporting or other barriers to proper documentation should be communicated. Documentation of all interactions, conversations, instructions, and findings is integral to safe practice. According to expert opinions from both sides, in addition to the expert opinion from several nurse practitioners sought out in support of the defense, the nurse practitioner departed from the standard of care. Her failure to properly document and failure to follow up with the patient's history resulted in the metastasis of the colon cancer and ultimately death. An indemnity payment was made on behalf of the nurse practitioner. This, along with related defense expenses, resulted in a total incurred amount in excess of $740,000. A summary of the legal implications for this case study reveals the following. The nurse practitioner could not fully explain why she failed to document her conversation with the patient about having a colonoscopy and his subsequent refusal. The nurse practitioner attributed her lack of time between patients and the complexity of the office reporting system to the poor documentation. Expert opinions from both sides all agreed that the insured nurse practitioner departed from the standard of care in regards to this patient. Due to the numerous failures that resulted in the patient's death, the insured nurse practitioner was identified as having the greatest percentage of liability, and a monetary decision was made to settle the claim prior to trial. Understand and maintain the scope and standard of care that applies to the relevant setting, including determining whether the patient's clinical symptoms can be appropriately and safely managed. Obtain, review, and consider pertinent patient and family medical history and document all findings. Document all patient-related discussions, as well as consultations, clinical information, and actions taken, including any treatment orders provided or offered. A complete health information record is the best legal defense. Inform the patient in writing that his or her non-compliance with treatment recommendations could result in worsening of symptoms and disease processes. This completes our case study on failure to diagnose colon cancer. We encourage you to stay current in your practice by visiting the following resource.